Welcome to a James Bell Associates podcast series on pathways to child welfare careers. This podcast series was developed on behalf of the Children's Bureau, Administration for Children and Families, U.S. Department of Health and Human Services, by James Bell Associates, a consulting firm based in the Washington, D.C. area that provides research, evaluation, and technical assistance services in child welfare and related human service fields. For this podcast series, we'll be discussing programs and initiatives at the federal, state, and local level, and through partnerships with community colleges and universities, to assist students in obtaining the academic and professional credentials needed to launch careers in child welfare, and to support current professionals through ongoing training and support programs. To introduce listeners to an array of perspectives on building and sustaining the child welfare workforce, Drs. Anita Barczyk and Leah Bouchard with James Bell Associates will be speaking with child welfare professionals, students, and academics who each bring unique and valuable insights into the various avenues for launching a career in child welfare and for aiding current professionals through ongoing training and support systems. Thank you for joining us as we learn about educational and training pathways for careers in child welfare.
Hello, this is Anita Barczyk.
And this is Leah Bouchard.
Today we are thrilled to speak with Dr. Anita Barbee. Dr. Barbee is a professor, distinguished university scholar, and Ph.D. program director at the Kent School of Social Work and Family Science, Center for Family and Community Wellbeing at the University of Louisville. She and her team at the Kent School, along with partners at other universities, independent research firms, and nonprofits, have secured over $100 million in extramural funding from numerous local, state, and federal agencies. They have used this funding to develop, execute, and evaluate training and other interventions to build capacity in family and youth-serving organizations, including child welfare, and to improve policy, practice, and outcomes for families, youth, and children affected by trauma. Welcome, Anita. We are so happy to have you here.
Thank you so much. I'm delighted to be with you.
Great. So to get us started, I was curious, what was your pathway to focusing your career on child welfare? We've heard so many different pathways, so if you could tell us yours, that would be amazing.
It is an interesting question that I don't often think about, but although my childhood was great, my grandmother was abused as a child in the 1920s, which affected her mental health, and she ended up being abusive to my aunt. So I heard those stories and was worried about that kind of dynamic in a family. My father also was abused by his siblings who were much older than him. So I grew up with that kind of sensitivity to those dynamics in family. Ended up going to the psychology first, the social psychology Ph.D. with a family development co-major because of that interest. And I started out in the psych department running a lab with my husband, who's also a social psychologist here at the University of Louisville, and really wanted to do, I was doing other community work and wanted to do something more hands-on and impactful and applied. We would call it applied in our field. And so there was a job over at the Kent School to evaluate a Children's Bureau grant on training of child welfare workers working with families with substance use issues. This was in 92. I mean, this is 30 years ago. We're still talking about this.
Yeah.
And then that turned into a job where I was evaluating all the training. And I went to all the training in order to understand what they were teaching so that I could create tests, knowledge tests and things. And really did ride-alongs and just try to understand the field and really liked it. And thought, this is really interesting. So I went back to school and got my master's degree, did my field work for a few years in the Public Child Welfare Agency on the medically fragile team. And I've never looked back. So 33 years, it's taken over my life, but it's been a good journey.
That's fantastic. It's so interesting how it's never linear. Very few people have a path from, I decided I wanted to do this and now I do it. So it's always cool to hear how people arrive at it. Dr. Barbee, in addition to the research that you conduct, I know you've been a trainer focused on clinical supervision at the Oklahoma Supervisor Academy. Could you talk a little bit about this training and the knowledge and skills that you hope supervisors gain from it, particularly the focus on the indirect trauma-sensitive supervision model?
Yeah, we've been working in the supervisor training space since 2000 when we developed a training for a practice model. And that got me really interested in this clinical side of
Mhm.
how do you help supervisors work with their staff to change how they're interacting, how they're engaging, how they can use evidence-based and solution-focused approaches with families. And so all of that learning, we studied that for over 10 years, and then I ended up helping California develop their own model and implement it. And around that time, Oklahoma went into a consent decree, and they started the Pinnacle Plan, and I was charged with evaluating the supervisors in terms of their competency. And so in doing that, we realized where some of the gaps were in the supervisory understanding of their jobs. And so I worked with them to develop the whole new supervisor academy. And they gave me this piece because of that background. And so it's kind of a two-pronged approach. It's looking not only at the direct work of the supervisor with their staff as they work with families and again, really monitoring the practice and making sure that people aren't using their assumptions and attributions that are inaccurate as they're working with families and keeping an open mind and those kinds of things. But also taking a step back and looking at their understanding of their own workforce, their emotional reaction to the work, which I'll get into in a minute with this Brian Miller model, um, and understanding all the things that can get in the way of their ability to work, period, but especially with families and, in just a tight moment in their lives with us knocking on their door. And so we work through a lot of them understanding that parallel process of how they work with their team and treat their staff and whether they really support them or not, especially since under so much stress, really will play out with the staff in the practice. So you almost have to start with the worker, and that's what we do. And then a piece of that clinical supervision, they had brought in a psychologist from Utah named Brian Miller, who's written a little bit with folks in the trauma field about some of his take on why uh, folks in child welfare end up having secondary trauma, trying to look at those mechanisms and trying to see if we can intervene through supervision to undo those. And his hypothesis, based on social psych research, ironically, is that when we're taught when we're working in child welfare inappropriately, so that when we're with a family, we try to keep a clean slate of no judgment, although we're looking for maltreatment or problems or issues, to really just look very objectively at that and to suppress any emotions that we have at the moment we're with families and not show in our face the shock of the roaches all over the wall or the mess or the hoarding or all the things that can happen in a home or as they're interacting with their children and showing harsh behaviors and those kinds of things. And then informally, they might talk about what happened in the field with a friend or with their supervisor. But he's saying in suppressing that, it kind of takes you to the research that finds if you suppress, like this white bear test, and if you say, don't think about a white bear, invariably, and this is done in experiments and in the real world, people can't not think about the red bear and the white bear, and the time that it takes or the emotional and cognitive energy that it takes to suppress the white bear prevents you from being cognitively complex and being able to do other tasks.
Oh, yeah.
So it does two things. It both pushes it down, and then what you find with the white bear thing is that it still pops out somewhere. Number one, so it's going to show up somewhere in your attitudes towards that family or other families. It's going to interfere. And then secondly, it's going to affect your ability to do good work. So that suppression and not having a release valve for talking through in a very systematic way what you saw, what you felt, what made you think, what were your thoughts before that feeling, like what attributions you're making. So if they say the roaches were crawling on the wall, the supervisor, we work on asking a lot of good questions about, well, what happened that made that be the case. And what often is unearthed, for one, they get the emotion out, right? So they get to talk about this, which is very hard. It's hard to get the supervisors to even go down this route because they're used to just moving into the case. And it's like, we just want you to focus on these folks' emotions for a minute. And it's okay for them to say that it was disgusting. The smell made me sick. It made me very angry that these children live in the circumstances, all those things. And so, but partly what you're trying to get them to do is say, well, where's that coming from? Why is the situation the way it is? What could be happening in a family or with a person that they would be that way? And what often comes out, and we just kind of play this out in the training, is these negative attributions of internal cause, like they don't care, they're lazy, they don't clean enough, they must not care about their children because they let them live in this kind of circumstance, whatever, or they hurt them or whatever. They take the drug because they don't care. And then the big thing he says to do, once you've unearthed all that, is to help them begin to think, well, what are some alternative explanations for this? So that they can move to compassion, a more holistic, contextual understanding of why people are in these circumstances or what's going on in their lives at this moment or in some period of time. And then when they start to use their brains, you move them from the right to the left side of the brain, and they're thinking, okay. What we find is you then ask with that question, then they come up with things like, well, maybe they never learned how to clean the house, or maybe they're sick, or maybe they're disabled, or maybe they've got a mental health. And then all the other things come up that gives you some efficacy of, well, let's go explore that and find out what else is going on. It also then lowers that judgment and that negative feeling. And so his hypothesis is, with all of this, if you can help people unearth the emotions and the thoughts behind it and do some cognitive restructuring, basically some CBT, and get them to shift, but to move to compassion and do that for like the first couple of years. And he's saying in every meeting or every time a worker goes out or is working with families, that you do debrief in this way. It doesn't take long, that over time they'll begin to rethink or question those feelings. And have more compassion and empathy, which then means you're not all bundled up and with all this negative energy and emotion and negativity towards the families, and then the secondary trauma should dissipate.
So I'm sure everyone's thinking about a white bear right now, because I know I am. And it's so interesting that there's like an application for that, because I know I've taught that so much in my classes. I was curious, what supervisory efforts and supports has the research community evaluated and found effective at reducing the turnover and burnout in child welfare workers? Because we know that happens a lot.
Yes. Yeah. And, the research kind of drives this training that I've been describing. And so the biggest finding across many studies with different measures of perceived social support from your supervisor finds that's a huge thing that affects whether you intend to leave or actually leave. So again, that relationship between a supervisor and their staff, in the sense that there's two aspects of this. One is, do they just support me as a human? And do I feel like they give me the support professionally to do the job through quality supervision, stepping in to help, those kinds of things. But also, do they and the agency have my back?
Hmm.
And or are they going to throw me under the bus if something bad happens? So it's a multitude of pieces, because social support is a very complex concept. But overall, if they feel that closest to their supervisor, they feel like they can trust them, they feel that they're there for them, that they're supporting them in all the ways that good supervisors do, not just administratively, but in terms of their learning and growth and being able to do the work. So that's a huge finding in the literature. Another piece of that that we found in a study we did in Ohio, because I've had a hypothesis for a while that, because I remember when I was in social psych, or maybe I didn't say it, I studied close relationships and social support.
Yeah.
And so, and because I come out of both the developmental and family field, attachment theory is one of my favorites. And so there's research in the attachment field that finds that when the attachment schema, which we all walk around with, we have it from childhood, it shifts, it changes. We can have different attachments to different people. But once it's primed, like just talking about families or talking about childhood or any of those kind of things can prime the schema that we always walk around with, and we act based on that schema, whether it's being securely attached and trusting the world and thinking the world's a benign place and that I can really engage the world, or being insecure and anxious of I really want to engage, but I'm afraid to because I'm afraid I'll get hurt. No one loves me as much as I need to be, or kind of avoidant where you're kind of pushing people away and not trusting. And so we gave a measure of attachment to the supervisors and to the workers in a study we were doing on secondary trauma reduction. And what we found is that it correlates with the style of supervision, so that secure people are more democratic and engaged. Avoidant or more avoidant or more laissez-faire. It's like, just get away from me. Go do your job. Good luck. And the anxious are authoritarian and controlling. So if you're and they're mercurial, that their mood, they treat you based on their mood. There's all kinds of issues. So, and we found that when a supervisor was more secure, the person had less secondary trauma and stress and other outcomes, including an intent to leave. So when I introduced this to this class, what I talk about in the beginning, I say, tell me all about what a great supervisor is. And they list all these traits: trustworthy, open, helps me when I need it, supportive, good expectations, good feedback, clear, blah, blah, blah. You got to be perfect. So it's a good list. Then we go over, what does a securely attached person act like? And it's everything. And I say, look, and I give them the scale, and I say, you may not be that way by nature. You might have a schema that's different, but you can act in these other ways. You just have to be aware of how you see the world and yourself. And if you and the environment, is triggering of this, it's priming, and it could shift people. So they seem to respond to it well, that the insight has helped them. And in some of my follow-up with them, we've talked about how that helped them rethink what they were doing or why they might be wanting to react a certain way, and realizing, if I want to do this list of what I think is a great supervisor, I've got to kind of overcome my own insecurities or feelings or need for control or wanting to push people away and just be there. So that's been another interesting thing that we're going to add to the literature. It's not out there yet. Most of the other things are just other organizational culture and climate, and workload, and managing the stress in other ways. So really, it's the supervisor's key, because there's other research that finds that most people leave their boss, not the job itself. They might like the career, but not like the person they're working with. So there's a lot of exciting things that we can understand about that relationship to try to shore it up, that we're looking forward to continuing to delve into.
That's so interesting, especially when you were talking about the attachment theory piece, because there's so much evidence that looking at things in an interdisciplinary way from multiple, so you're able to look at it social psych way and the social work way. And I just love that you were able to kind of use those two sides of your brain to make that a interesting study.
Yeah, and what's interesting is that, of course, the workers come with their own, and it's an interaction effect. So if you're anxious and you want to be kind of nurtured and accepted and loved, and your supervisor's avoidant, that's a bad combination.
Right.
So we talk about those dynamics as well and how to manage people with different styles. The other kind of alarming thing we found is that at least in this state that we were working in, most of the people had insecure attachment styles. What we don't know yet, we need to look at the data and gather other data to see, is this developmental? Do you come in already kind of, remember, 80% of child welfare workers have a trauma history.
Right.
So they may already have a disrupted attachment. Or do they get there and the environment and the work and the pressure and the traumatized environment that you're in? This is why trauma-informed organizations are really important, because it may be that that's a mechanism that's keeping that at bay.
Yeah,
So
that
interesting.
makes sense. You've talked about this some, thinking about clinical supervision and how the support is so essential for the child welfare workforce, just for retention alone, but also for making sure that they're taken care of as people and also as employees. So I'm curious if you have anything to expand on that, of why you think clinical supervision and workforce support programs matter so much for the overall well-being of the child welfare workforce.
Well, I mean, you're working at multiple levels, as we've kind of said before, that if you're taking care of the emotional needs of people and helping them be kind of clear there, they can attend to the more cognitively complex, difficult aspects of the job and become more competent. So this is almost blending two things in once, that you're kind of helping them manage their emotions, their regulate, while you're also helping them think very critically about what they're doing with folks and how they're making decisions and what's helping them come to conclusions by asking lots of good questions and giving them feedback on their reports and helping them talk through assumptions and things. And so I think it's that blend, and that if you don't attend to both, if you just say you need to do this, this, and this, but you're not understanding that what's influencing it in terms of thoughts and feelings, and just saying, okay, I'm just going to use behavior and I'm going to reward these behaviors and punish these. Humans are a little more complex than the behaviorist thought. And it's important to do that. And so I think, and what we find in our work when we did the intervention in Ohio was both everyone got this thing called Resilience Alliance, and everyone learned at all levels of the organization how to manage the stress and the trauma that they were being exposed to, and learn some very specific coping skills. And they did it together. They were in groups, and so they would learn together and practice in between weeks. They did it for like 6 months. And they also, of course, ended up forming a social support network. But at the same time, while they were learning all that, because you can't just blame the victim, coping's not enough. The organization's got to shift. And so at the same time, we had the supervisors use kind of a coaching approach that was more supportive in their supervision. We ended up later teaching them all this stuff about attachment and other things to shore that up. But we found that combination of the supervisor really attending and reinforcing all this, but also them being clear and healthy. That combination led to great outcomes in all the ways. So looking at all these levels is really important when we're doing retention work.
Sure, and so important to be intentional
Yeah.
about the way you're working with frontline staff. Absolutely.
Right, because they're going to pass on what you do with them to their families.
Yep.
Yes, that parallel process. Yeah.
Absolutely.
So Leah and I are both social workers. We have social worker backgrounds. And so we're going to ask you the miracle question. If you were to build your ideal worker supervision and support program, what would it look like? And I also want to know how we can make that a reality.
Well, again, we've done it in Kentucky at the time when we were doing our practice model. We're going to try to do it again. Now we've got some influence in that area. We've done it in Oklahoma. We've done it in other places. I think with any kind of implementation of change, if you have to decide that's what you want, right? And everybody's got to kind of agree. This is tricky because everybody's got to agree that this kind of level of support and emotional and cognitive as well as behavioral intervention with folks is the right thing to do. And so leaders have to buy in. And if they have an authoritarian or very strict way of looking at things, they may not buy in, and it's really hard to because it flows. You can almost see where I can go in an organization and see what the managers are like over certain supervisors and where it's coming from. So it's got to be at all levels of buy-in and belief that this is the way to go, and everybody's got to enact it. Again, that's what we learned in that one state. And then you obviously have to train, but you've got to then reinforce it, and that's why everybody needs it, because you've got to have each supervisor at every level reinforcing that learning and that way of being. And then you got to build in something to hold people accountable, and so that's where we haven't gotten to yet. I wished we could have done a study on who do we promote to be supervisors, because there's fewer of them in the whole agency. And we have a lot of choice there, but we don't have a lot of structure in how we promote them. There's other disciplines, the police, others have a lot of things that people have to go through to become a supervisor. We're not that rigorous. And if this was one of those things that you need to have that mindset and that temperament and that belief in how to work with people, and that we can give you the skills in how to do it, you got to have that thing. That would be one way. And then to hold people accountable for what's happening in their teams. Again, I understand that people leave for lots of reasons. They get pregnant and decide to stay home, or they move, or there's other things. But if it's controllable and they're leaving and if you notice a pattern on one team, everybody's leaving it. Not necessarily out of the agency, but to other teams. We don't have conversations about that. So you've got to have those kinds of accountability supports, and then do more work. I'm not saying fire anybody, but do more work with those folks to help move them along so that they can get past that problem. I think that all that would go a long way. But of course, like with any implementation, it takes time. It takes concerted effort. You got to keep your eye on the ball. You got to keep it going. And as leaders change, this is what's hard about child welfare, as leaders change, as new pressures come in, new initiatives, it's hard to keep that at the heart of what we're doing. But I think it's possible. I just don't know how long it could last without a reboot.
What types of things would be in that training? Like, what kinds of things would you be training the supervisors on?
That's a lot of what I've said that we do in the Oklahoma training, of helping them understand, what is the agency facing? How is it traumatized? And how that plays out, what that looks like, what those dynamics are. And then, giving those very concrete skills of how to help people manage that. And just giving supervisors the skills in assessing their people and really kind of meeting the people where they are, both developmentally. Like, for example, some people do need a little more hands-on supervision, especially when they're new. And then as you build trust and as you get to know their capability, you can let them go a little more. And so there's times to be more in it and more kind of distant. And so teaching those kinds of skills of how to assess that and where your people are and when to lean in and when to kind of let people go, all of those kinds of skills, as well as this clinical piece, towards the worker themselves and the work itself, would need to be all part of that.
That's so interesting. I just want to thank you again for joining us today.
Thank you for having me. It's fun to talk about it.
Yeah. And your work is amazing. It's really advancing the field, and hopefully all the other states in the country can start working in this manner and training their supervisors.
Yeah, that's wonderful. Thank you so much.
Thank you so much for the opportunity. You all have a great rest of your day.
Thank you again for listening to today's podcast. Remember to stay tuned for our upcoming episodes, in which we'll continue to bring you information about the pathways to build and sustain productive and rewarding careers in child welfare. If you enjoy our podcast episodes, please share them with your colleagues and others who may find them relevant and useful. We're your hosts,
Amanda Barczyk
and Leah Bouchard, and this has been a James Bell Associates podcast.
This podcast series was produced and distributed by James Bell Associates on behalf of the Children's Bureau, Administration for Children and Families, U.S. Department of Health and Human Services, under contract number HHS P 233-201-500-133I. The opinions and ideas expressed in the podcasts are those of the panelists and do not necessarily represent the official views, policies, or positions of the Children's Bureau, the Administration for Children and Families, or the U.S. Department of Health and Human Services.